That should be recording now, Peter.
Okay, thank you. Fiona, are you going to read it out?
Yes, happy to do that, Chair. Welcome to this meeting of the East Lothian IJB on the 16th of September 2021, which is being held remotely in accordance with the Scottish Government's recommendations as regards physical distancing during the COVID-19 outbreak. This meeting is being recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council and NHS Lothian are the data controllers under the Data Protection Act 2018. Data collected as part of the recording will be retained in accordance with the Council and Health Board's policies on record retention, and the webcast of this meeting will be publicly available for up to 6 months. Do you want me just to move on to the roll call? Apologies.
Yeah. Yes, please. Can I just proceed?
When I call your name, if you could confirm that you're present, please. Shameen Akhtar.
Present.
Neil Gilbert.
Present.
Sue Kempson.
Present.
Patricia Donald.
Present.
Richard Williams.
Present.
Peter Murray.
Present.
David Binney. Philip Conaglan. Lorraine Cowan.
Present.
Richard Fairclough. David King.
Present.
Ian Gorman.
Present.
Thomas Miller.
Present.
Judith Tate. John Turville.
Present.
Leslie White. And Maureen Allen. I know that Claire McIntosh is going to join us later, and we have apologies, Chair, from Alison MacDonald and from Marilyn McNeil. Can I ask members if they have any declarations of interest to make on any of the items of business? No, that's great, thank you. And we can pass to you, Chair. I think you wanted to change the agenda order, is that correct?
Yes, thank you. With everybody's indulgence, I would like to take the Chair's report first, because myself and Ian want to make a few remarks about Errington. So I know Ian has got to go at past for a short period. So if you don't mind, we'll take the Chair's report first. So is everybody content with that? Yeah. Okay, thank you. I'm just going to focus all of my remarks on Errington, because I think it's important that myself and Ian get a chance just to cover a few important issues in relation to it. And some of what I'm going to convey is just facts that I would like you to be very familiar with, because clearly there's some misinformation in the system that inevitably follows on from decisions such as these that people, for very legitimate reasons perhaps, are not content with the decisions being made, but nonetheless misinformation is not helpful. So just quickly to confirm that on September the 1st, some will know that there was a number of contacts made in which I was involved with stakeholders to advise them that there was going to be a relocation of staff from Errington into the main hospital in Haddington, and as Ian will cover, that Errington was going to be used for a particular purpose for a period of 12 weeks initially, and then during that 12-week period a review would be undertaken to see if it was then safe, and I'll cover that again in a bit more detail in a moment, if it was safe to return to the original use of Errington. There was a press release sent out, and the press release confirmed what was a Gold Command. For those who are not familiar with that term, the Gold Command is effectively NHS Lothian meeting with senior staff and deciding on important issues about how the very challenging circumstances that they're facing could be met more efficiently and effectively and safely. So they took the decision to, through Alison, the Chief Officer, to temporarily relocate the staff, as I've just alluded to the main hospital for a period of 12 weeks. Ian will cover the detail of what that actually does in a practical sense when he comes in just a moment. As I also alluded to, we've received in the intervening period quite a number of communications from people expressing concern about the lack of consultation. And the only response I would offer with regard to this is that this is a highly unusual scenario that we are being faced with. It was a critical decision made out of a critical scenario that, again, Ian will cover in more detail. So I would ask for some latitude in the normal expectations that people have, very legitimate expectations that people have on the amount of consultation and the time for consultation that ordinarily would take place in this instance, because if we didn't react with the speed that we have reacted, then the situation, again, that Ian will describe, would just have got worse. So we had to react quickly, and I think it's only reasonable to allow a degree of latitude in those circumstances for the normal consultation that would have taken place. I want to clarify something really important that, again, may be misinformed by some of the communications that have gone out, that nothing in this response to this crisis changes the Care Home Provision Change Board work. These are two separate issues entirely. The Errington change is about relocating staff to make more efficient use of those staff for the safety of patients and the safety of the staff concerned. So it's really disappointing, and I am heartfelt sorry for those that have been involved in this, that I've read just yesterday two things, one on social media and one where there is a petition that has now been signed by up to 7,000 people that suggests in its opening phrase that the Errington Hospital is closing. It is not closing. So I am really disappointed that a petition of that type with misleading information has been sent out in the way that it has, and it does nothing to help the broader challenges that Alison and her team are facing up to in making really difficult decisions about how they use the staff and how they continue to provide the important care that they do across this whole of the East Lothian area. So before I invite Ian, I just want you to be aware that health and social care staff working in East Lothian are working under immense pressure. And what we should be doing is following behind them, supporting them in making the decisions they've got to make, all of whom they recognise will not always be welcomed by every member of the community, but are done so for the greater good. And I would just ask you to appreciate that. So Ian, would you mind coming in and describing the detail as to why or what the relocated staff are going to do that's slightly more efficient than having them relocated at the Errington Hospital, please?
Okay, Peter. So I think there's a couple of things I was going to talk about. One is I think the challenges that we're facing and have continued to face, but are becoming more and more acute. Really, in particular, since the changes of the restrictions meant that COVID numbers started to increase throughout Scotland and really put enormous pressures on our frontline staffing. So that really fell out at the beginning of the summer and affected a number of our areas in a very practical and understandable way, that services which are frontline, if you have somebody who then needs to isolate for 10 days, we're constantly having to juggle all of the pressures that we have across all of the system and all of the demand that we have to sustain core services. Now, there's been changes to legislation in the recent months which have made that slightly easier. So the full isolation period is not always required depending on the circumstances, and PCRs allow staff to return to work. But the reality of it is that across the HSCP, there are daily meetings to look at all of our staffing groups and assess how safe they are. And that is because fundamentally, at any point today or any point previously, at any point tomorrow, we might get someone who has to phone in and say, I cannot come to work. I've got to self-isolate and await my PCR result. And in what was an environment where it was always challenging and complex to support staff, that's become an even bigger risk. I think as well, we've started to face a risk that, and everyone on the call on the meeting will appreciate this, that we've been dealing with this now for 18 months, and there's a level of exhaustion among the staff. And everyone is doing what they can, and everybody is trying, but people are quite rightly looking for their holidays, looking for the breaks, looking for their time off to recuperate for when they're next on shift. The other element that's made this challenging is as part of this extended pandemic response, and as all the work we've done, we've seen that we've developed some new programs, some new systems, some significant parts of response that have meant that recruitment and retention has become exceptionally difficult. So we have worked with through NHS Lothian with all of the mechanisms that we would normally explore around staff bank, staff agency, requests for assistance, and we have done so as a whole system across NHS Lothian, and it has been escalated as a whole system to Scottish Government to say these are the challenges that we are facing. And as a whole system, you know, this is not just East Lothian HSCP, but it's felt by our GPs on the front line, by our colleagues in the community. It's felt by the NHS as a whole, by the hospital sector, and it's felt by East Lothian Council and by our other partners that help us here. So, you know, that whole system pressure means that flows into A&Es are slower than they would normally be. We are struggling to manage that pressure, and our responsibility as an HSCP is to keep people at home as much as we can, but once they're admitted to hospital, to help them come back through the system safely and efficiently to the right places. And over the last few months, it's become more and more challenging to sustain that on a whole system basis, and more and more challenging to sustain that within East Lothian. So the approach made to us through, and indeed across the system, across NHS Lothian Gold, was what other mechanisms, what other opportunities would there be to take to create opportunities to ensure the safety of the system and the efficiency of the system. And this was viewed as one of the areas that would allow us to do that, because the beds which are available within the Eddington site and are fully staffed have served a purpose to the community, and a really important purpose to the community, but the staff that support those being brought into the ELCH become part of that critical mass that supports that whole facility, and allows us to then balance those daily conversations about where we can operate safely and fundamentally have more beds available for the whole population of East Lothian, and be able to more effectively respond to immediate and short notice staffing crises. Those immediate responses, those plans have happened today, they will happen tomorrow, and they will happen going into the subsequent weeks as we look to see how we can redeploy all of the different teams that we have that keep services running. And it's fair to say that from a system perspective, we can do that more safely, better for patients, and more efficiently using the ELCH site than we can than trying to hold multiple satellite units. I will add to that as well that the ELCH is a very good facility, and we have shown over the last few years that East Lothian as a partnership has brought more people home, and they're staying at home in higher percentages than they ever have, or at least in the last 5 years. And we've done that through using the facility, the ELCH, and the combined multidisciplinary approach that we have from that facility. So it's not to take away from the incredible sense of ownership and of privilege, you know, and of desire that people have to sustain the services in the Eddington at this point in time. But in order for us to keep the system running as a whole, it is better to consolidate the staffing group and safer. It's not an easy decision to make, but it's one we felt we had to. I mentioned I was going to talk about 3 challenges. So I've talked about the staffing issue, but the second challenge, which is facing us quite heavily at the moment, is the care at home provision. So within East Lothian, our care at home provision is primarily delivered by contracted providers, external companies who provide care at home, and it's fair to say that they're facing the same challenges that we are facing within our organisation. And we have internal provision for care at home, so an opportunity again, and we are doing this every day, to meet, to consider where the risks are and opportunities, and work with our providers to ensure that the care is delivered where it is needed. But because it's such a significant proportion of our provision is external, there is always a risk that if one of these providers starts to struggle to deliver, our response to that has to use a significant proportion of our resources. The second part of that challenge is that we have always, and we have brought to IJB, sustained a very good performance in terms of delayed discharges, and that part I was talking about earlier of management of flows through acute. It is again becoming harder and harder to do that, because one of the primary ways in which we bring people home from hospital is with support from care at home, And actually, while the providers are struggling with the same workforce pressures that we are, it becomes more and more difficult for them to take additional packages and sustain people at home. So the pressures on the system, are felt from that, and our requirement to respond to that again requires a range of resources. I would say again that this is discussed and escalated through NHS Lothian Gold, and we see this pressure in the system coming right across other partnerships as well. And my understanding is that it's being felt nationally. And certainly some of our larger providers are national providers, and they're having those challenges in other areas. And the third area, which is a challenge for us, and I just wanted to briefly talk about it, is the vaccination program. That's a significant undertaking of which East Lothian has, I feel, done very well, and we have done our best to deliver that program and everything that is involved with it, but it is enormous. And there are changes to that program that require to be operationally worked through. So you all have seen the announcement in the beginning of this week around the vaccinations for 12 to 15-year-olds. And we're currently in the process of working through that workforce to understand how best to deploy it in order to deliver those vaccines. Those represent around about 50,000 people, maybe just shy, just over 40,000 people across the whole of NHS Lothian that would require vaccination between 12 and 15. The workforce to deliver that in tandem with the vaccination program, in tandem with the flu program, in tandem with the immunosuppressed groups and the other requests of the government, are the same workforce, are the same people, significantly in part, who deliver frontline services to our other areas. So while it's an incredibly important programme, it is also an area where we're having to focus resources to ensure delivery. And again, that has been escalated on a pan-Lothian approach to Scottish Government to seek support for the workforce to continue to deliver this. But I think we'll see publicly some discussion about vaccination provision over the next few months. And I would absolutely give assurances that we are doing all we can operationally to manage it, but we're having to do so in light of these other challenges. So as a whole system, we're trying to respond, and as a whole system, we're facing significant pressures. Peter, that's all I plan to say on that. And apologies, because I appreciate it's a lot of information, but I feel those three areas in particular are where our largest challenges are right now, and will probably continue to be over the coming months.
Yeah, thanks, Ian. I think it's really important that people understand the context in which the Health and Social Care Partnership are operating. Patricia, we're not able to take any questions at the moment. If you have any queries on this, please direct them to Ian, because I know he's got to leave very shortly. So rather than try and hold him up, because I know it's an important meeting he's got to leave to go to. But Ian was happy to take any questions outside the meeting, so please send them on. Any queries that you've got, or for more detail if you feel that's what you would like. But it was important just to present this from the editing perspective as a much broader analysis of why decisions are made that may look in isolation to some to be unreasonable and for some to be against a very passionate emotional attachment that they've got to certain ways in which services have been provided. I don't in any way underestimate the strength of feeling that people have for local facilities and their desire to protect them. But just to conclude, as a reminder, the Errington is part of a broader analysis of care provision that's still underway. This is a separate decision that's been made to deal with a critical scenario that Ian has outlined extremely well to you. And I hope that at least as conduits for us through the IJB to the various communities you engage with, you can at least help the broader understanding of why decisions have been made. And that's all I would ask of you and conclude this particular part of the meeting, the Chair's report. So thank you for listening, and I appreciate your indulgence on this particular item. So Ian, if you need to go, then by all means fire away, and if you're able to come back, that'll be great. Ian?
You happy to move on?
Yeah, thank you.
Okay, we'll go back to item 1, which is the minutes of the meeting of the IJB on the 24th of June, and these are for approval.
Thank you. So I'm not going to go through them page by page. I would just invite anybody to bring to our attention any areas where they feel that the minute is not an accurate reflection of that meeting. I'm not seeing any hands up immediately, so I'm going to assume that we are content and they reflect an accurate account of the meeting. So thank you for that. So I'll hand back to you, Fiona.
Thank you. Item 2 is matters arising from the minutes.
So on this occasion, I will go through them just page by page. So I'm going to start on page 2 of your pack, which should be the start of the minute itself. So just shout out, or sorry, just put your hand up if you've got any issues you wish to raise. Page 3, 4 of the 99 pack, 3 in the page numbers, 4, 5. Sorry, Richard, you've got a comment.
Thanks, Peter. Just very, very briefly, item 6. I had mentioned previously that my membership looked as if I was there as a GP, but I'm not a GP, I'm a retired GP. And the question I'd asked was, did they wish me to attend as a member of the IJB, or did they wish a GP to attend? So I'm not sure I've had the answer to that yet.
Okay, can I take that offline, Richard? Thank you for reminding me of that. Thank you. Anything page 5? 6? Sorry, the noise in the background is my dog throwing a ball about. 7? No, nothing. Other than Richard's point, thank you for raising it, Richard. It was remiss of me not to deal with that earlier, so I will get to that ASAP. I'll hand back to you, Fiona.
Thank you. Item 4 is the changes to the non-voting membership of East Lothian IJB. Now, standing orders require that because this includes the reappointment of John Turville and Thomas Miller, they need to leave the meeting at this point. If they could, and I will email you very shortly to let you know when you could rejoin, if that's okay.
All right, I'll give them a few seconds to leave us. If you let me know, Fiona, are they gone?
Check. Looks like it, yes.
Yeah. Are you going to present the report, Fiona? Or yeah.
No, I can do that, Chair. It's fairly straightforward as per the recommendations in section 2. We have 3 separate parts to it. The first is that Maureen Allen is replacing Paul White as the non-voting member and third sector representative. The third sector representative on the IJB is something that's they put forward a nomination to us. It's not something that the IJB does itself. The second point is the reappointment of John Turville and Thomas Miller as non-voting members in their current roles. And the third is that Claire McIntosh is to replace Emma Rainish with effect from last month. It was approved at the NHS Lothian Board. So it's really just for members to consider and if they're happy, approve these changes.
Okay, if anybody wishes to dissent from any of the recommendations in 2.1, 1, 2 and 3, could you please raise your hand? If not, I will take it that we accept those, and if we can, I think it appropriate to write to Paul to thank him for his contribution. He made a valuable contribution, so I think we should do that. And we very much welcome John and Thomas's continuation in the meeting. I'll tell them that when they come in. But Claire, who's not with us at the moment, I'm very hopeful that Claire will be an active member of the IJB because we need that kind of skill set in our midst to help us with the connection back into acute. So, Fiona, you going to invite them back in now, please, before we move on?
Yeah, I will do. The recommendation, I'm afraid, has to be done by roll call, so I'll just...
Right, sorry, beg your pardon.
So for the voting members, if you could just confirm whether you're happy to approve the recommendations as set out. Shameen Akhtar.
Approve.
Neil Gilbert.
Approve.
Sue Kempson.
Approve.
Patricia Donald.
Approve.
Peter Murray.
Approve.
And Richard Williams.
Approve.
Thank you very much. I'll just email them now. That's the recommendations approved. hopefully they'll be able to join us in a minute or two. Do you want me just to move on, Chair, or do you want to wait?
If we just hang on for a couple of seconds, if you don't mind.
While we're waiting, if I could just say that the next item involves David King's appointment. So David, I'm afraid it's the same procedure for you. If you could leave, and I'll email you when we've concluded the item. That's both Thomas and John back, Chair.
Okay, thank you very much. Do we have Maureen?
No, I don't think she's in
No.
at all. So.
Okay, I'm sure she would have been here. Must be an issue with this guy. Anyway, I did say in the absence of those that have just rejoined us, I'm pleased that both John and Thomas have been extended. So thank you for being willing to continue your tenure, and look forward to your ongoing participation. And that we welcome Maureen, and would have done had she been here. Maureen will be a strong contributor, but we were thanking Paul White in his absence, and we will write to Paul just to acknowledge his significant contribution during his time as a member. So we can now move on, Fiona, if you don't mind.
Yep, thank you, Chair. Item 5 is the interim appointment of the Chief Finance Officer. I don't know if you want to cover that yourself, Chair, or if you want me to do it.
No, you continue on.
Right. Okay. The members will recall that there was a report that came to the IJB just before the summer recess, just outlining the proposals for putting in place a temporary replacement for Claire Flanagan. And this report just outlines what has happened since then, and asks the IJB at section 2 to approve the appointment of David King as Interim Chief Finance Officer for the period of Claire Flanagan's maternity leave. So that's really, in essence, I think members will have read the report, so that's what you're being asked to do today. I don't know if there's any questions or comments on that.
Any questions? No. Do you want to take the roll call, Fiona?
Will do. Okay, if members could indicate whether they're happy to approve. Shameen Akhtar.
Approve.
Neil Gilbert.
Approve.
Sue Kempson.
Approve.
Patricia Donald.
Approve.
Peter Murray.
Approve.
And Richard Williams.
Approve.
Thank you. That's great. That's approved unanimously, and I'll just email David very quickly to get him back in the meeting.
He's up in Aberdeen at the moment, so it could take a while. Fiona, I've just noticed while we wait for David that Fiona Donald's texted me to say that could you send her?
Apology, Peter, I'm actually here now.
Oh,
The connection's been restored. So
right.
thank you. Thank you. Shameen also came to the rescue, but that's me back. Lovely
Right.
to see you all.
Good. At what point did you join, Fiona?
Just as you said, somebody was in Aberdeen.
Okay.
Are we waiting for Ian Gorman? Is that the?
No, we're waiting for David King to rejoin us. But just as a quick summary, Fiona, for your benefit, we had an input just from myself and Ian, just factual information and in context of Errington. So we had a bit of a discussion about that. Well, not a discussion, an input from both Ian and myself, and we've just done some approval of members continuing on in the IJB and members joining us, 2 new members join us, Claire McIntosh and Maureen Allen.
Great. Welcome, Claire and Maureen, I know very well, and thank you for that update. I'm very pleased to hear there has been a factual update in relation to the Eddington. People are entitled to their own opinions, but not to their own facts. So that's really good to know the community will get an accurate picture of what's happening.
Yeah, thank you, Fiona. Is he back yet, Fiona?
Yes, it looks like David's back in the meeting.
Yeah, I'm back, Chair. Thank you.
Right. Thanks very much, David. And you'll be glad to know it was approved almost unanimously.
Almost. I'll be listening to the recording later on.
Fiona, can I hand back to you, please?
Yes, thanks. The next item is item 6, which is the East Lothian IJB 2020-21 Annual Audit Report, and we have Esther Scoberg here from Audit Scotland.
Hi, Esther. You're welcome.
Hi, thanks very much, and good afternoon, members. I'm pleased to present to you the 2021 East Lothian Integration Joint Board Annual Audit Report, which starts on page 17 of your pack and is the concluding part of our audit. So this report and the ISA 260 report, which was the report charged to those with governance, were presented to the IJB Audit and Risk Committee on the 14th of September and were agreed and recommended to this board for formal approval. So the accounts are due to be signed on the 27th of September. So I'll just briefly take you through the report and happy to take any questions once I'm done. So part 1 of our report on page 22 of your pack focuses on the annual accounts, and we concluded that they give a true and fair view and there was no adverse impact from COVID-19 on the audit process or the ability for the IJB to deliver the accounts. Our proposed independent auditor's report is an unmodified opinion, and there were no material misstatements noted in 2021. So we also have no significant findings to report on the accounts, and there were no misstatements that exceeded our materiality or reporting thresholds. There was one small adjustment to the accounts, which we've noted in page 24, in paragraph 24, also on page 24 of your pack. Part 2, starting on page 25, refers to financial management and sustainability, and we've provided positive assurances in this respect, but we do recommend that the medium-term financial plan and budgets are revisited to factor in the increased costs and funding for COVID-19 and the impact it's had. We understand it was a moving feast during the year and presented challenges to all involved. Exhibit 3, page 26 of the pack, notes the earmarked underspend of reserves in 2021 of 7.2 million, and this has been agreed with the partner bodies. I'd just like to point out that further along on paragraph 32, it doesn't, in page 20, it doesn't seem to accord with that table. So it's the underspend position, if a lay person reads it, won't understand. And the reason the figures are different is because the position of the IJB changed rapidly at the year end. This is similar to many IJBs. So my proposal is to clarify paragraph 32 with a sentence that's in your draft to state what the actual underspend was at year end. And it's not going to alter any content of the message, but provide what I think is improved clarity and transparency in our Audit Scotland reporting. So I hope that's okay with you all. We also refer further along to the integration scheme. and the postponement of its review in paragraph 41, which I know this board has discussed. The scheme is the key link to the partner bodies and should be considered by the IJB in line with the revised timetables set out and reviewed and revised as appropriate. Part 3, page 29 of the pack, summarizes our findings regarding governance, transparency, and best value. Overall, we found that the governance arrangements weren't adversely affected by COVID-19 and business progressed as usual. We noted the change in CFO on an interim basis for maternity leave cover, and we had no issues in respect of this. And it was lovely to see David King again. Regarding best value and performance, we highlighted the delay to the production of the performance report, and we have made a recommendation that this is addressed going forward. So members are presented with up-to-date information on how the IJB is performing overall, and that this should be presented at board level for evidence of review and scrutiny. Page 60, paragraph 61 on page 31 of your pack highlights the good practice we've noted, and we forwarded this on to our central health team for consideration in the national NHS overview report. We felt it was a good example of responding to a situation in a timely fashion, really reactive as well, that had a positive impact on staff and users of the service. So a nice good news story at the end of our final report. Appendix 1. Page 32, we've raised 2 recommendations and we're satisfied with management's responses, and these will be followed up as part of our 21-22 audit, which will be our 6th and final year of the audit appointment. Appendix 2 on page 33 reiterates the key risks we noted in our annual audit plan and how we have satisfied ourselves and concluded on each one, and there were no issues noted for any of those. And finally, Appendix 3 highlights some of the Audit Scotland national reports that members may find interesting and for future reference. And lastly, I'd like to thank Claire Flanagan, who's not here, but Claire, David King, and Lynn Allen, as well as the other officers that assisted us during the year. It's all been helpful and has worked really well, and I'm happy to take any questions you have on the report. Thank you.
Thank you, Esther, and apologies for not welcoming you at the start of the meeting.
That's okay.
Any questions for Esther on the report? Yeah, I've got David King and then Richard Williams, please. So David.
To be fair, mine is more of a comment than a question. So if Richard wants to ask a specific question first, I could come back and make a comment later. I don't know. Okay, thank you very much. I mean, I welcome this report, obviously. I'm sorry, I'm trying to read another thing here. And the first point about the medium-term financial plan, now clearly there's been a whole series of issues with COVID, and our partners are working on what a post-COVID financial plan might look like. But you'll remember a very, very good presentation that Claire brought to the IJB, and it was all about future financial planning, and we looked at the current information, or the information that was available. And these financial plans always kind of say the same thing, you know, gap, big gap, very big gap. And Claire then started to say, well, what the IJB now needs to consider is all the transformational work that it's underdoing, how it's changing the balance of care, and how those actions will help to balance the financial plan. And she instructed me quite clearly, and I've discussed this with Alison, but we're very keen to push on with that. And I hope to bring back to the IJB in October an update in the financial position and a further discussion about how we are going to arrive at a balanced financial plan, which will not be a simple task. It wouldn't have been a simple task without COVID. It'll be a great deal more complicated with. But I just like to say that that's a thing that's very important on my agenda, certainly, and we will continue to work on that.
Thanks, David. That's helpful. Thank you for those observations and comments. Richard.
Thanks, Peter, and thanks, David, for the opportunity. But mine is also a statement, comment rather than question. Audit's not my strength, I have to say. So to me, Esther, this was a very clearly set out and easily understandable report. So thank you very much for that. And my take from it was, because you had no significant qualifications or amendments, that just tells me that what we've been receiving as a board has been robust, accurate, timely, and I think this speaks volumes for the quality of what we as a board have been receiving from our colleagues over the years. So thank you to you and thank you to colleagues.
Richard, that's very kind of you to say that, and I'm sure that Claire in particular, although David has recently taken over, Claire would be particularly pleased to hear that, and hopefully somebody will be able to pass that on to her. So thank you for taking the time to make that observation. Patricia.
I just want to also say that at the Audit and Risk Committee 2 days ago, we also were very, very impressed with the quality of the report, the assurance that we were given, and therefore it reflected on all the hard work. So we also sent our thanks and congratulations. Shameen was there as well. So I think very well done, East Lothian. Is that really what we're saying?
Thank you as well, Patricia. It's great, and it's a shame that two of the main participants in this aren't here to hear those, but I'm sure, as I say, they will get that through. Either I will communicate that to them, or some colleagues on the call will ensure that they are advised of that. I just wanted to add, if there's no other questions, that the good practice, I think, is also a testament to some of the comments that have been made. You know, the fact that they saw fit to add that in as an area of good practice and share it across the country, I think speaks volumes for that particular piece of work. And as David rightly points out, that the medium-term financial plan is going to be an interesting discussion and a challenge for all of us. You've seen the figures as they are outlined as to what the magnitude of that financial gap or gaps is going to be over the years. So we'll all need to be conscious of being innovative and being prepared to accept that some change needs to happen in order for us to keep that balance in the budget. So if there's no further questions or comments, Fiona, I'll pass back to you. I think this is just for noting.
Yes, that's right, Chair.
Yeah. So no roll call required. And thank you again, Esther, for presenting that report.
Thank you, Chair and members.
Okay, thank you. We can move on now to item 7, which is the 2020-21 audited annual accounts, and it's David King to present.
Thank you very much. I think, given the conversation we've just had, this is the kind of formal agreement then that the annual accounts can be signed by those officers who represent the IJB, and they will then go to our colleagues at Scottish Audit, who will then sign them off as the appointed auditors. I should say straight away that I've actually made an error in this paper. I was just looking at it again, and it says the accounts will be signed by the Chair, the Chief Officer and the Interim Chief Finance Officer. Now that is correct, but they will not be signed by the current Chair. They will be signed by Councillor Akhtar. We did agree that that's what we would do at the time. And in fact, if you look at the annual accounts, you can see it's Shameen's name at the bottom of the appropriate page. So I do apologise for that error. That's my fault. I was sort of putting this thing together, and I'm thinking to myself, how does the process work? I should have thought, how does this specific process work? So I do apologise for that. But anyway, the recommendation is that the IJB approves, in quotation marks, the accounts, and therefore they are signed off by the appropriate officers.
Okay, is that you, David? Any questions or comments for David on the accounts? I can see Shameen's hand, his hand's just gone up.
Thank you, Peter. Thank you, David, for presenting the report. It was a question about funding and cost consequences for next year, and it came up at the Audit and Risk that NHS Lothian has submitted the remobilisation plan to the Scottish Government, capturing the impact for us in East Lothian, which covers the period April 2021 to March 2022. And I just wondered, at this stage, was there any update that you might have?
I haven't had a chance to have a detailed update. My understanding is that work is ongoing, and I've been attending various national groups in actual fact. There's been a lot of discussions about the resources available for code. There's a considerable concern, actually, if I may just distract slightly, that during the crisis itself, there were offsets. There were things that we were not doing, and therefore those resources could be released to support work in COVID. Now we're remobilising the system again. We're trying to do the things we should be doing and support the pressures from COVID, and therefore there's fewer offsets. So the financial pressure is greater. And then there's a very, very serious concern about what will happen next year, in the next financial year, when there's a huge question mark about what funding we will have available to us and what the tail from this whole process will be. So I haven't had a proper conversation about this. I apologise. You did mention this a couple of days ago, and I simply haven't had a chance to do that. But I will go back and I'll bring that back to the IJB. I'm sure Fiona will pick that up as an action. And I'll once I find the details out, I'll drop you a wee note as well, if that's okay.
Thank you.
Thank you.
Okay, any other questions? For those that haven't been able to read every word of this, I would actually recommend that you do, because it makes a very good story of the work that's gone on through this year. So I would actively encourage you to read this report, because it does paint a really good picture of what's happened. And I just wanted to comment on the second paragraph under management commentary, where it speaks about a huge thank you to all the staff involved in this challenging period. And I think as an IJB, we should wish to echo that quite resoundingly, because it has been quite incredible what they've been asked to do over this last 12 months, and the real difficulty they've been asked to work under is, and it's not finished yet clearly, but just for the period of time that we're reflecting on, I think it would be appropriate for us to minute, as well as noting that it's in the report. But as an IJB, we wish to echo those sentiments. Okay, no further questions on this report. I will hand back to you, Fiona. I think this is just for noting also.
No, this is for approval.
This is for approval, beg your pardon, I'm ahead of myself.
That's okay. So we need to do another roll call. So as David outlined, it's to agree that the IJB's annual accounts can be signed electronically on behalf of the IJB. So I'll go through the roll call, and if members could indicate whether they're happy to approve. Shameen Akhtar.
Approve.
Neil Gilbert.
Approve.
Sue Kempson.
Approve.
Fiona O'Donnell.
Approve.
Patricia Donald.
Approve.
Peter Murray.
Approve.
And Richard Williams.
Approve.
Thank you very much. That's the recommendation approved unanimously. And we can move on to item 8 now, which is the National Care Service consultation. It's an SBAR report, and I think it's Paul Curry to present this.
So sorry, unfortunately I must go now. I do apologise to the committee. I have already apologised to the chair. Thank you very much.
Thank you, David.
Should I begin, Peter?
Yes, thank you.
Yeah.
Paul.
Thank you, members. This is a short paper which is describing to you some work that's been carried out to engage with IJB membership on producing a response to the national consultation on the establishment of a national care service. This, as you'll recollect, is a recommendation from within the Independent Review of Adult Social Care, the so-called Feely report, which came out at the beginning of this year, and has for the last few months been in Scottish Government being worked up, and the consultation documentation as a result of that work within Scottish Government. It's fair to say that it's a large and complex consultation. It runs to 90 or so questions. It covers a number of things that we were expecting to see as a result of the Feely report, plus some extensions into areas of working that were perhaps not clearly articulated within the Feely report, or are extensions of what the Feely report has suggested. But there are issues of particular interest that will have an effect on the IJB, both in terms of changes to the duties and responsibilities that are within the current IJB structure, membership, and areas of work that you oversee. As this IJB, as it's proposed, and other IJBs across the country are developed into new bodies which will have more responsibilities for integration, including issues like budgets coming direct to these new bodies, so-called community health and social care boards. So yet another acronym to be learned and made comfortable with. So the work that I did looked at presenting the consultation exercise to members and seeking responses with a view to producing a distillation of those responses to go in on behalf of this IJB. The returns I got were limited. I had 2 returns, and as such, in discussion with the Chair and Chief Officer, we felt it was necessary to perhaps try a different approach to get members involved in the discussion about the recommendations. So the intention is to develop, or ask you for approval to develop a development session. It's going to be, I think, early October rather than late September, to give you all an opportunity to discuss the implications of the consultation for health and social care services, not just in our county, the area of direct interest, but also in terms of what's happening more widely at government level and in terms of the National Care Service as a national body, the health and care equivalent of the National Health Service. And the intention of that development session is that we would then have material provided by yourselves through deliberation and debate that would allow us to put a consultation forward on behalf of this IJB to respond to the national consultation exercise. Should just say that this approach has been taken by other IJBs across the various areas in Scotland, and there's been variable engagement with the IJB members, and there's been some decisions made on behalf of some IJBs not to put forward a proposal because it's not been possible to reach consensus. But my view would be that any consultation response would be helpful if it shows a range of opinions, a range of viewpoints from across the IJB, because you as members of the IJB represent very different professional groups, very different interests, have different experiences. So I would see a development session as a way that we could perhaps describe in full colour and depth the sorts of things that we feel to be opportunities or issues around the proposed development of a National Care Service. So I'd be grateful for your views on anything within the paper, any questions I can answer, and particularly for your thoughts on the 2 recommendations.
Thanks very much, Paul. I'll come in with some comments myself after Patricia and Fiona have asked the questions. So Patricia, you first, please.
Paul, I completely support the opportunity to have a further discussion. It's very difficult to do a personal reply to huge numbers of pages. My feeling is that the IJB and particularly the partnership are experts on integration and should be participating in a consultation like this, but perhaps have been busy doing other things. So having a bit of time set aside with some structure to comment, I think, would be helpful. And of course, there's significant implications to the IJB itself, which we began to discuss at the Audit and Risk Committee, because we feel there is a risk to the entity of an IJB anyway. And Richard and I will recall many reorganisations in our time, which actually paralysed how many, Richard? It just paralyses the delivery of services for so long. So I think, again, that's a risk, while obviously accepting that there's a great need to upgrade the social care system. So long comment, but I would welcome an opportunity to discuss further. Thank you.
Fiona, if you don't mind, I'm just going to join in Patricia's comments, because one of my main comments was in line with what Patricia's just said, in that the most worrying thing for me and what I've been able to engage with so far is a lack of recognition of 5 years of endeavour by a lot of people working very hard to get us to where we are. And if we just reflect back on the previous report by Esther, we've got an area of good practice that's been identified. Well, that's one amongst many. So we need to be very cautious that we capture all the good before we start putting the pieces of the jigsaw back together and a different picture emerges. That's just my personal view. That's not the IJB's view. I was just according my view to Patricia. So if you don't mind, Fiona, I just wanted to add that in.
No problem. And are you wanting to come back in, Paul? No, great, thank you. And I enjoyed Richard's unpleasant flashback face there. And I think equally anything about IT systems also fills me with dread. The idea that we're going to try and put in place an IT system which will talk to each other. I'll keep my views on the survey that was circulated for the development session, but there was one area in particular, Paul, I thought community justice, where certainly, even though I was on the partnership, I didn't feel able to provide an informed response. So if we could get some input on that. But also the report goes well beyond what Philly looked at. So there's been no consultation on social work, on children's services. So I wondered, are we just going to, certainly with children's services, are we just not going to comment on that? And have colleagues in the council indicated that education and children's services would be, or Shameen may know the answer to this actually, that they would be submitting a response. Thank you. I'm very happy with the recommendations.
You're on mute, Peter.
Sorry. Shameen, did you want to comment on Fiona's question, or shall I just go to you?
I see Judith's hand is up. I think she might be able to comment because she's leading on East Lothian Council's response, so I'll let her reply.
Thank you, Shameen. And Judith, please fire away.
Thanks. Yeah, thanks very much, Peter and Shameen. So yes, so Council Chief Executive has asked me to coordinate the Council's consultation. And we have a series of short life working group meetings with officers from the kind of key services across the council as they relate to the questions in the consultation and those that are not in the consultation, I think, to give a nod to Fiona's earlier point. And our plan really to do then is to draft a response for discussion at CMT, and then we have a members briefing arranged on, I think, 12th of October to consider that draft response. Now, I recognise the range of complexities at play here in terms of which hats people have on when they are making that response, and no less for me as Chief Social Work Officer, because there may well be a different response for what I think is right for the social work profession in order to protect and promote that as a single profession with cross-cutting skills and knowledge versus what I may think is right for children's services in East Lothian. So it is a complex landscape, not helped by the approach, I think, taken in the way that the consultation has been worded, that doesn't make it easy to give a response to that. So it may well be that the Council's response focuses on the key areas of the consultation that are particularly pertinent to the Council as an entity. That would be around the areas of governance, structure, finance, HR and workforce, and that we have yet to conclude how far we will move into the professional detail of some of the questions around that are aimed at, you know, what kind of assessment of need do you think is right for people? So that's the arrangements for the consultation from the Council's perspective, and the kind of challenges that we're currently teasing out.
Thank you, Judith, and apologies, I hadn't noticed you were here. Thank you.
Yeah, thanks, Fiona. Judith, thanks very much for describing really well some of the challenges that a response by an IJB is itself going to face, because there'll be different perspectives, even individual perspectives amongst us all. So I know that a neighbouring IJB has decided to focus on one particular area of response and not respond to the breadth of the questions. And there are other areas that I think are applying a similar approach. The only thing that I would perhaps, although it's late in the day, encourage people to do, if you've not been able to do it so far, is that the consultation events that are being run by the Scottish Government are actually quite helpful, and they do tease out some useful interplay between different perspectives on the themes that they've decided to cover. I think there are 3 left still to run up to the period when the consultation closes. So I would encourage you to look at the Scottish Government website for those consultation options on the themes. I think the next one is fair work. I'm sure that's what the theme of the next consultation is, and then there's a wrap-up one at the end on every aspect of it. So if you've not already taken part, I would encourage you to look at those. Judith, did you want to come back in on that point? I invite Siobhan in.
Yes, thanks, Peter. I suppose I really wanted to stress that the message from Scottish Government is we want to hear your views, and actually you put them in any way you wish. So there is an email address on the consultation website. You know, so I'm assuming from that means if you have a view that doesn't neatly fit into one of the boxes, then that wishes to be heard. I hope that's true. So I hope that the comments that go into the free text boxes will be duly noted and taken into account. My advice is, if they link to a particular question, make sure you link that in the response, so that the response isn't taken out of context. Would be my advice on that. But also, the Minister has written out to different professional groups, urging them to make their own contributions to the consultation on behalf of their professional. So I think whilst we may have misgivings about the shape and the style of the consultation, there are plenty of opportunities to input to that into it.
Yeah, and that's certainly the message that comes across at each of the consultation events, Judith. So I think that's backed up by the very strong views that are expressed. And if just as a kind of personal confirmation of that, the IJB chairs and vice chairs, which I chair the Scottish group, they've got a separate questionnaire running that's going to be fed into the approach, and they've actually welcomed that, what we're calling added value, into the consultation. So it backs up what you said, Judith. So thank you for that. Siobhan, did you have a question?
Yeah, it was just more of a kind of comment for Paul and Judith. I'm really glad that the proposal that you put forward, Paul, and I support that in putting together a consultation response. And I'm glad, Judith, you're working on that as well. And I'm glad that colleagues worked hard to try and extend the deadline. I know it's not by a huge amount of time, but it just gives people a little bit of extra time. And it's just unfortunate that everybody's got their heads down as well at the moment. It's a difficult time for people. So I think I welcome the people that are in the background that have done that. I think we might all have different perspectives of all of this, but I think people's goals are the same of how we're going to improve outcomes, and people might have different perspectives of how we do it. But just from this morning, I was at the Community Justice Partnership, and Karen McCluskey, the Chief Executive of Community Justice Scotland, was there, and this was one of the issues that came up. And so we were asking her about what input and feedback she had in the response in the consultation document that's been out, and there hadn't been any consultation. So I think it's really important that, I know it's really difficult, but we encourage as many people as possible to look at the sections that are relevant to them and make sure they pass on their comments, because I think maybe not the level, there's not been the level of consultation with the key players that should have happened, and it's important that we try and encourage that.
Thank you, Siobhan. Any final comments or questions before we go to the recommendations? No. Recommendations are on page 88. You'll see those, and we'll do a roll call of those if we can, please. Fiona?
Yes, thank you, Chair. The recommendations, as you say, are to agree to the development session, and also to agree that the outputs of any development session should be used to prepare the East Lothian IJB's response. If I could ask members to indicate which way they would like to vote. Siobhan Akhtar. Siobhan, are you happy to approve? Good. Thank you. Neil Gilbert.
Approve.
Okay. Sue Kempson.
Approve.
Fiona O'Donnell.
Approve.
Patricia Donald.
Approve.
Peter Murray.
Approve.
And Richard Williams.
Approve.
Thank you. That's the recommendations approved unanimously, Chair.
Thank you.
We can move on now to the last item, which is item 9, the Community Transformation Program, Adults with Complex Needs over 65. And I think we have Christine Johnson here to present.
Thank you. Yes, the paper just provides background and an update on the programme for over 65s, which we've discussed previously at IJB. One of the things that's changed since IJB in June is that we were successful in obtaining additional investment for all the day centres for their outreach work. That was a result of CARES Act funding for 2 years from the Scottish Government. But for today, really the purpose is just to highlight our intended approach to commissioning. So previously our intention was to look at a 4-year framework to sort of balance the longevity of funding for the centres, but also our requirements for transparency and the allocation of a sort of significant amount of money, it's about £1.2 million. But in having those discussions, I've highlighted in the paper a number of risks and issues that stakeholders have raised. And one of the most significant ones is really from the trustees of these small charitable organisations themselves about their lack of capability to respond to a public contract tendering exercise. And I think crucially also their nervousness about accepting accountability for the outcome of that process. So that's a key risk. The other issues are really around timing. So as we've heard, there's a fragility in social care at the moment, and we don't want this process to unintentionally provide a more uncertainty to existing providers. So I should make it clear that the quality of care that the day centres provide and the value for money is exceptional, so that's not the issue. The issue is really around the governance of these small charities. So looking at all those issues, there's also some around timing, which is, we discussed previously around commissioning an integrated centre-based model with the outreach, and obviously with the additional funding from the CARES Act, we've got that for 2 years, but that doesn't align with the previous proposals around a 4-year framework. And as we've been hearing, there's a lot of uncertainty in the sector around COVID recovery and the National Care Service. So what we're proposing is that we look to extend the current arrangements to the end of March 2023. Our colleagues in procurement and legal have expressed some concerns around that because of the extent of public money, but also obviously our requirements around procurement regulations, standing orders, etc. But they do accept the landscape that we're operating in and some of the constraints and the risks that I've set out. So in order to mitigate some of those risks, some of the actions that are proposed are that we work with the Association of Day Centres, that's the representative organisation for the 9 centres, to help build capacity and address some of those risks. So looking particularly at training for trustees, linking them in with other public sector organisations that can help build capacity around funding and so forth, such as the Partnership for Procurement and indeed our colleagues in Volunteer Centre East Lothian. So that action plus looking at a light touch approach to commission until the end of 2023, I think would mitigate some of those risks. So that's the position with the current 9 centres. As we've discussed before, there's a gap in provision in Musselburgh, which our proposal is to develop a meeting centre approach for people with dementia. So really for today, just to update that project plan is progressing well, all work streams are progressing. We're looking at service model, the funding model, locations, etc., with a view to that commencing in April 2022. And we want to continue the collaborative approach to that, which puts carers of people with dementia and people with dementia at the centre of that whole service model. And we will continue that in what's called a public social partnership approach to collaboration. So that's the update on the 2 kind of strands of work with the day centres and the meeting centre. Happy to hand back to the chair for any questions.
Thank you, Christine. And obviously this was given a good hearing to strategic planning group, which is referenced in 1.1, but I would invite other questions because some members may not have been at that particular meeting. So Fiona, I see your hands up.
Thank you, Peter, and thank you, Christine, for the report. And I certainly know the value of the 9 individual independent charities across East Lothian. I'm just thinking back to our self-evaluation exercise, and one of the areas identified where we could perhaps do even better in East Lothian was in relation to best value. And I just wondered how we will be able, we know the value, but how are we going to be able to demonstrate best value in terms of the commissioning and delivery of this service, please?
Okay, thank you. So we'll be looking at in two strands, I suppose. One is around outcomes for the individuals and how they are, and I think the centres are very good at being able to demonstrate what they're achieving. They've all put in place much clearer service review plans and personal plans for the members that attend, and they're all working very hard in terms of developing the outreach. So we would look at that in terms of personal outcomes, and the other element would be benchmarking with other partnerships. So we've done a significant benchmarking which shows that in terms of the cost of this to the partnership, it's extremely good value. So we have that kind of data to present as we go forward.
That's really helpful, Christine, and especially as well after some of the input we had from the care inspector. It's great to hear that they're rising to those challenges. Thank you.
Thank you, Fiona. Any other questions for Christine? I just a quick question, Christine, if there's no other colleagues wanting to ask. 3.4.3, which you've focused on, the light touch application process, does that in itself present any additional risk?
I don't think so, because basically what we'll be doing is a scaled down version almost of a tendering process to give them a sense of the information that in future we would look for in a more public process. So we'd be looking for them just to set out their service objectives, how they'll meet personal outcomes, and some of the key compliance around health and safety and GDPR, etc. So I don't anticipate them having any problems in engaging and completing that process to a good enough standard.
Okay, thank you, Christine. Any other questions just before we go back to the recommendations, which we need to do a roll call? Shameen.
Thanks, Peter. It's more of a comment just to add to what Christine is saying. We've been meeting regularly with the Association of Day Centres and listening to their plans for opening up and listening to any concerns, etc. that they've had. So I think this paper will be very welcomed by them, especially the continuation of funding until 31st of March 2023. And I think the general feedback has been that as they have slowly been opening up, they have been able to provide really valuable respite support, which we know is a priority for many carers across East Lothian. And I think the work that Christine has done is to commend her on the work of extra investment for outreach work, especially for carers. And that's been very welcomed by them and enables them to provide the support where it's needed the most. And I think having been to the Haddington Day Centre, John Bellini and the North Berwick, and getting a sense of the work that they've been doing has been really, really valuable, of the support that they provide within the day centre, but also the support that they provide when that person then may move into a care home, and the continued journey that they have in ensuring that the care home are knowledgeable about that person and know them really well, so that their transition from support from the day centre to at North Berwick, for example, to the care home is as smooth as possible. So I did say when I went to visit them that I would relay on some of the good practice and some of the good work to IJB members, and I was kind of keen to do that, to pass that on. And I have said to them, if there are areas of good practice and work that they're doing that you would want to know about, to pass that on, and I'd be keen to circulate that to IJB members, so we've got a good sense of the work that they're doing across East Lothian.
Thanks, Shameen. Christine, do you want to respond to that at all?
No, just to say I'm happy to collate some of that and pull that together if that would help.
Christine, would it be a fair assessment of mine, bearing in mind that you've done an awful lot of work in this over a number of months and years perhaps, that this is a good reflection of how you have responded to the issues that have been raised to you by the people that are involved directly by the proposals you've outlined? It seems to me to be exactly that. And you know, we get a lot of criticism for not consulting, but I think in this instance, my reflections on it are that you've consulted well, you've responded well, and you've taken this forward in a very measured way. Is that a fair assessment?
Yes, I think so. I think it is a collaborative process, and been keen to hear the views and to look at the wider picture. You know, we don't want to cause a decline in any of the quality of service to vulnerable older people. So we have to think about all the different challenges and look at a way that we can build capacity and capabilities going forward for the future.
Yeah. Thank you, Christine. Thank you for all your work on this. Okay, Fiona, can I hand back to you? I think we've just got to take a roll call on 213, is that correct?
Yes, that's correct, Chair. I'll just go back to the recommendations. Yeah, the recommendations at section 2, recommendation 2.11 is just to note the background. 2.12 is to note the risks and issues in commissioning older people's day centres, and to approve the proposed approach set out in 3.4.2. And also recommendation 2.13 is also seeking approval of mitigation actions. And the final recommendation is to note the update and to approve a further development of the public social partnership approach as set out in section 3.5 of the report. So the majority of the recommendations are for approval, so I'll just take them as a whole if members are happy with that. And if you could indicate whether or not you're happy to approve all of the recommendations as a whole. Shameen Akhtar.
Approve all the recommendations.
Neil Gilbert.
Approve all.
Thank you. Sue Kempson.
Approve all.
Fiona O'Donnell.
Approve all.
Patricia Donald.
Approve all.
Peter Murray.
Approve all.
And Richard Williams.
Approve all.
Thank you very much. That's the recommendations approved unanimously, Chair. And that's the end of our business. And just to say that Claire McIntosh is now in the meeting. I think she joined us back in Item 8.
Right. Claire, Claire, you and I are to meet separately, so hopefully that will be of value to you, but welcome as we close the meeting. But we look forward to your participation in future meetings.
Thank you very much, and apologies for joining late.
That's okay. You missed all the excitement, Claire.
Yeah, unfortunately, hospital COVID.
Yeah. Okay. As I say, we'll meet again soon, Claire, so look forward to that. So at the end of the agenda item, we're asked to invite you all to mute your microphones before the recording is switched off, which I'm just about to do. So if you can all do that, please, and we'll switch off the recording.